going to bring up our very distinguished next guest who's going to close the morning session for us, Commissioner Helen Caulton Harris, Springfield's Division of Health and Human Services.
Good morning. This has been, since I've been here, an amazing morning that has had a lot of information and has had a lot of conversation. And for me, it really fell into three buckets: education, legislation, and advocacy. And so what I've heard really has been stated well around bridge building, silo busting, weaving together strategies, community engagement, the power of behavior change and individuals' ability to do that, the healthcare system and some of the barriers and some of the challenges and some of the work we must do together. I heard about legislation and policy change and our need to change policy, and some of the examples were around transportation, workforce development, the issue of tax credits, busting down the silos again. It really is important. Affordable housing are some of the work that is before us. Rebalancing the funding formula so that Western Massachusetts is a voice in how funding gets distributed across this Commonwealth. Also, sustainability as far as the workforce is concerned, the environment, housing. We've been told to rise up, lift up, and embrace our power. And so, in fact, we have had a morning of individuals sort of mobilizing us, giving us lots of information. But I always wonder, as I come to these conferences and as I have these discussions and as I look out at all of you, we ask a lot of questions. We say, how do we? And so I need us to ask ourselves that very same question: how do we? As we move into the afternoon, I would ask that this not be another conference where you came, got great information, heard wonderful words from Amanda and our panel and our speakers, but that you internalize it and move it out to some action strategies. Too many times we come, we listen, we disperse, and nothing else happens. Our community cannot afford for us to continue to do that. So that issue around advocacy and believing in the power that is in you as an individual, because there is the ability to make change and to make sustainable change. We are on a journey. The journey is a journey that really, as it said, is not a sprint. It is not a sprint. It is a long journey. Prevention and intervention takes time. And we need to make sure that the voices of our community and those individuals we live with and around are part of our conversation. We cannot make decisions for individuals. We have to include their voices in the process. And so, wonderful panel, wonderful information, but the individuals whose lives we really want to influence and help them change behaviors around eating, around substances, around their lifestyle, really, those are the voices that have to join with our voices. And I'll tell you, if we believe in our power and we believe in theirs, that's how movements start and sustain themselves. So I'm looking for a movement from this conference, because we in the great city of Springfield are ready for a movement. Enjoy the afternoon. I thank you.